Okay, today we're going to review the side lying release position. So we are going to start with our beautiful pregnant person on a bed. And you're going to bring the person to the side edge of the bed. And you as the support person, which is usually going to be the partner, you're going to stand your body right up against that bed, the edge of the mattress, so that you feel like your body's totally supported. So you're going to ask them to roll towards you. They're going to stay scooted over towards the edge of that bed. They're going to roll straight over on their side so that their belly more or less falls in between your legs. Then you're going to have them scooch their hips even more forward towards the edge of the bed. So the pregnant person may feel like they would fall if you were not there to support them. You want them to be in that position where you're the only thing sort of supporting them. Do you feel comfortable and supported in this position?
Yeah.
Beautiful. So you want to then make sure that her body is in a straight line. Almost as if I had a giant ruler, I could like line the ruler up with her spine. So scoot this bottom forward just a little bit more. Perfect. Beautiful. So she looks like she's not twisted. I'm going to now have her lift this top leg straight up and then dangle it forward. So at this point, yep, and you can bring this leg back a little bit. At this point, the weight of her top leg is going to bring her even more forward. So I want to make sure that when she rotates, her hips are not becoming super twisted. So she looks like she's in a great position. You're going to essentially just stand here with your legs wide, her belly between your legs, and you're just going to support her as she breathes. So if you want to come around and get a different angle here so we can see what we're doing, and you're welcome to put a little pillow underneath her head. She's sort of got her hand cradling her head so that her head is supported. Again, when we talk about the spine being in a straight line, you want to make sure you're including that neck in the straight line, that the neck is not going this way or this way. So she's just breathing. If you want to add a little bit of support, even though simply laying and breathing is already opening up the sacroiliac joints, it's relaxing the muscles of the pelvic floor. It can help baby settle into a more comfortable position because it's opening up some space. You can apply a little bit of pressure. You'll kind of find the bony part of mom's hip, and you can just sort of gently lean in. And sometimes this feels nice if you're doing this position like during early labor. It can feel nice to have a little bit of compression on the hips. Nothing too crazy. You'll just sort of gently lean in. Another modification I like, especially if mom is feeling a lot of compression in through her rib cage, is you can have her drape her arm up over her head like, as if she was gonna like, swoon. And with her arm just draped over her head, you're just gonna gently think about creating some space and elongating the point right above her shoulder with her hip. So I'm just thinking about spreading these 2 points apart gently as she breathes. And that's gonna open up all of this to the side of the rib cage. Good. And then when she's ready to come out, she just rolls back over. You make sure she doesn't fall. And then you do the other side.